Hello, fellow healthcare colleagues. Welcome to the Healthcare Motivation Channel. This channel exists to honor and uplift you because your dedication and hard work is inspiring. If you find value in this message, please like, subscribe, and share this video with a colleague to encourage and uplift them as they care for others. Today, we're diving into a topic that can transform your career, your safety, and your impact as a healthcare professional: Crisis Resource Management, or CRM. CRM began as crew resource management in the aviation industry. In the 1970s, a series of tragic airline disasters, most notably the Tenerife airport disaster in the Canary Islands in 1977, revealed that over 70% of aviation accidents were due to human error, not technical failure. The root cause included breakdowns in teamwork, communication, and decision-making. NASA and United Airlines pioneered CRM training to address these non-technical skills, shifting cockpit culture from a rigid hierarchy to a collaborative, assertive teamwork model. By the 1980s, CRM became a global aviation safety standard. Transition to healthcare. In the late 1980s, Dr. David Gaba at Stanford University recognized that healthcare, especially anesthesiology, faced similar high-stakes, high-pressure challenges. He adapted CRM for medicine, creating Anesthesia Crisis Resource Management, ACRM, which soon spread to emergency medicine, critical care, and beyond. What is crisis resource management, and why does it matter? Crisis resource management is about mastering the non-technical skills, leadership, communication, situational awareness, and resource allocation that keep teams effective under pressure. Why does this matter for you? This is important because in healthcare, a single moment of miscommunication or unclear leadership can mean the difference between life and death, not just for patients, but for your own well-being and for your own career. The impact. Research-backed results. Let's look at the data. 70% of avoidable deaths in healthcare involve a breakdown of crisis resource management principles, which include situational awareness, communication, leadership, and the ability to remain calm in a crisis. At least 100,000 deaths annually in the U.S. are linked to failures in crisis resource management skills. Crisis resource management training has been shown to reduce medical errors and improve patient outcomes across multiple specialties, including surgery, emergency medicine, and critical care. Teams trained in crisis resource management report higher job satisfaction and respect among colleagues, especially nurses, who feel their input is more valued. Crisis resource management implementation leads to faster, more effective team responses in acute situations, directly improving patient safety and reducing provider burnout. Crisis resource management for personal and professional success. How can crisis resource management help you thrive? First, there is self-protection. CRM teaches you to recognize your own limits, fatigue, stress, or uncertainty, so you can act before mistakes happen. As Stoic Marcus Aurelius said, "You have power over your mind, not outside events. Realize this, and you will find strength." Next, there is career safety. By mastering crisis resource management, you become a leader who is trusted, respected, and indispensable. You protect your license, your reputation, and your peace of mind. Last, motivation. Crisis resource management empowers you to speak up, ask for help, and support your team. These are skills that build confidence and resilience, both at work and in life. There are 3 actionable CRM strategies that can be useful to maximize opportunities for success. 1. Prioritize self-awareness and self-care. Before you can help others, you must check in with yourself. As James Clear teaches, you do not rise to the level of your goals, you fall to the level of your systems. A systematic tool can be used for self-assessment. For example, one tool to use is the HALT method. Are you hungry, angry, late, tired, or stressed? You must address these first before caring for others. Another example of this is using the I'm Safe checklist. According to Agency for Healthcare Research and Quality, the I'm Safe checklist is a simple tool used by healthcare providers to honestly assess their physical, mental, and emotional readiness to perform safely. I'm Safe is an acronym which stands for illness, medication, stress, alcohol and drugs, fatigue, eating, and elimination. Being aware of these factors is crucial for effective situation monitoring and teamwork, helping to identify potential impairments that could affect patient care and safety. Using these tools for self-assessment promotes transparency, open communication, and supports providers in managing stress and burnout to maintain high-quality healthcare delivery practice. Assertive communication. Speak up clearly and respectfully, regardless of hierarchy. Use closed-loop communication. State your observation, suggest an action, and confirm understanding. This reduces errors and builds trust. It's important to know that being leader is not about having all of the answers. Let me repeat that again because someone needs to hear it. Being a leader is not about having all of the answers. Being a leader is about speaking up and advocating, not just for your safety, but for the safety of your patients and your colleagues. Debrief and reflect after every crisis. After any high-stakes event, gather together as a team for a quick debrief. Discuss what went well, discuss opportunities for improvement. Discuss these issues in a way that will create solutions, not place blame on others. Turn every crisis into a learning opportunity and strengthen team cohesion. In conclusion, mastering crisis, resource management is not just about saving lives. It is about protecting your own life and protecting your career. Focus on yourself first. Be calm. Focus on assessing yourself. Master situational awareness and focus on speaking up when unsafe issues arise, even if it feels uncomfortable. When you take the lead and speak up, you advocate for yourself, your patients, and for the entire team. Make crisis resource management your daily practice, and you'll build a career that's not just successful, but unbreakable. Thank you for tuning into the Healthcare Motivation Channel. If today's message inspired you, please click like and subscribe, and share this video with a colleague to encourage them as they care for others. Stay motivated, stay focused, and we'll see you in the next video.